Good evening. Thanks for joining us tonight. Resources are being channeled to the southeastern part of the country after Hurricane Helene and Milton devastated that area. Helene impacted an IV fluid facility in North Carolina that provided up to 60% of the nation's supply. That forced it to temporarily shut down, causing a shortage of that solution nationwide.
However, the second largest IV facility in Florida is untouched in the wake of Hurricane Milton, making the situation less dire than it could have been. Still, hospitals are taking some creative measures to make sure care is uninterrupted, including here in Northeast Wisconsin. Brittany Schmidt checked in with several local healthcare providers to better understand the scope of the situation. Brittany.
Cami, Bill, several of our large providers in the area are monitoring the IV fluid situation closely. Right now, they are taking note of their stock and being more diligent about its use. But an important note to make clear right now is if you need IV fluids, you are going to get them, bottom line. None of the healthcare facilities I talked to today, including Bellin Health, Hospital Sisters Health System, and Green Bay ER and Hospital, are in a devastating shortage situation. But in light of what is happening and the potential impact in the future, they all have a proactive plan in place. They want to assure patients that they are taking the necessary steps to make sure they have adequate supply on hand to handle any emergency. But a chief nursing officer we talked to today says they are being diligent with their supply using alternative methods when allowed.
And then the next factor just becomes, physician discretion in terms of utilizing the resource. So traditionally, you come into an emergency room, you're not feeling well, you get IV fluids to kind of help get you feeling better more quickly. But in this case, we have to be careful with who those IV fluids are being dispensed to. So if a patient is able to take oral hydration, we would use that as an alternative during this time in order to conserve that IV fluid resource for the patients who truly need it.
Food and Drug Administration officials noted that a number of IV fluids, including saline solution, were already on the agency's drug shortage list before Hurricane Helene. Bill, Cami.